My name is Chris Kiefer from EM Deliberate Practice, and in this video I'm going to be demonstrating surgical microskills for the cricothyrotomy. So, in terms of performing this procedure, the more control we have, the better. Okay, so we've already developed a lot of control with our gross motor patterning, right? We have got our laryngeal handshake, which is stabilizing our larynx nicely. We have the dominant arm, the scalpel arm, forearm resting on the patient's sternum. That's taken a lot of tremor out of the equation. So now we need to do that even more with the scalpel. Okay, so what we need is a pencil grip. A nice choked up pencil grip here. Okay, and this really is to distinguish it from other forms of scalpel grips such as the fingertip grip, which is used often by surgeons in, say, performing a laparotomy where they need to make a great big long incision, a nice straight long incision. Okay, that's not the type of procedure we're doing right now. We're operating in a very confined area, often with other things going on, be it CPR or further airway attempts from above. Okay, so we're really trying to control our environment here. Pencil grip. So the second thing is just very basic, but looking at the scalpel incision techniques. Okay, so we're going to use two of these techniques. One is called a slide cut, and I think it's pretty intuitive, and we're all pretty familiar with it. But just to go through the basics, for a slide cut, you're puncturing the skin, and then you're using traction, right, to create your cut. Okay, so a slide cut. And that is different from our second incision, right? Our first incision being that vertical midline incision, which is really opening up the area and allowing us access to some of the more deeper anatomy. So the second incision, where we actually puncture through the cricothyroid membrane, is called a stab incision. Okay, pencil grip again. The scalpel is in a perpendicular relationship, and we are simply stabbing in. Okay, you can see once the scalpel's in, it's quite hard to extend that incision in a slide type maneuver. We can't just pull traction on that blade and expect to extend the incision. So what we have to do is actually saw. So we call this a stabbing and a sawing motion. Okay, and that's how we're going to open up the access to the cricothyroid membrane. This is a bit anxiety provoking, the idea of stabbing someone in the front of the neck. But this is where we get that concept of the laryngeal box, or the laryngeal cage here. So our cricoid cartilage, it's a signet ring shape. So it's narrow at the front and very wide at the back. Okay? And so what that does, people are afraid they're going to stab into the esophagus. Cartilage is pretty tough stuff. Not to say it's impossible, but you have a large margin of safety here for your stab straight down. You're stabbing into a cartilaginous wall, okay? And then when we're extending those incisions laterally, you're being protected here as well by the lateral rami of the thyroid and by the cricoid ring itself. Okay, so slide incision, stab incision. Those are your scalpel micro skills.